The biggest thing in the news right now is we reached 100,000 deaths in the United States. It's a sobering milestone. To put it into some perspective with other viruses like the flu virus, per season we have 20 to about 60,000 deaths from flu each season. That usually happens over the course of about 4 months. This took about 2 to 3 months, 100,000, and it's not over yet. We wonder if it's going to be seasonal. A lot of people think, well, with the summer, will this virus go away? Probably not. There are viruses that can be seasonal. We'll see with this one. I think that what's coming up for the next 3 months of the summer is that we'll have fewer infections, fewer deaths as people become more cautious. As the summer months come about, we are spaced out more and we're not inside as much. So I think there will be less this summer. I was watching NPR show by Dr. Ashish Jha. He's the director of the Harvard Global Health Institute, so his job is to watch things like this. And in his words, we are early in the outbreak, and I would agree completely. We're 2 months into this in the United States, and we're probably going to go 2 years with this. Now, it won't be the same over the whole 2 years, so it's not going to be as bad. What we did in the first 2 to 3 months of this pandemic was to strictly isolate, to keep it from spreading like wildfire. We've done that. Now we need to move forward with precautions and try to live our lives. So there's no getting rid of this virus right now. It's going to stay around. So that's kind of where we are in the virus. What do we do to try to slow it down? You know most of those things: social distancing, masks. Another thing is going to be contact tracking. That's when somebody is positive for the virus and they're in the community, then contact trackers will contact all the people that they were in contact with, try to get them to isolate for a couple weeks so that they don't spread it around. So that's something we've done for a long time with STDs. Departments of Health, if you had a STD, they would contact all the contacts and try to make sure they got treated so they didn't spread it any farther. It's a little easier to do STDs because there's fewer numbers. When you're talking about a virus that's spread by respiratory, that's a lot of numbers and a lot of exposures. So contact tracking is going to be done. It will help. It's going to be difficult. More testing will be available. Antibody testing is available. It's not for everybody right now. It doesn't prove immunity. It proves you've been exposed and you had a past infection. We'll see if having that antibody is protective. So over time, we'll say all these people with positive antibodies, none of them have gotten sick again with the virus that we know of. And then we'll know that that antibody test also shows that you have immunity. So overall, this the rate of this infection, when people of the rate of everybody who gets an infection, 80 to 80% are still mild illness. They have a cold, they stay home. About 15% will go to the hospital, and still 2 to 3% death rate of clinical cases. Now that doesn't include all the people with antibodies. So if you include all the people that got exposed with antibodies, the death rate is much lower. But when you talk about people with clinical illness, so besides contact tracking and isolating, what can we do for this virus? Well, treat it. There are drugs to treat viruses, not as many as there are for bacteria. So the one that's big in the news this past week was remdesivir. Now, remdesivir has been around for a while. In fact, it was tested with Ebola and with the other SARS viruses and had some effect then. So it's also been used in seriously ill people with SARS Cov-2. So people, especially in the ICU and on ventilators, were treated with IV remdesivir. How did it work? It worked pretty well. People who had serious illness, they had pneumonia, they had their oxygen levels down, their illness decreased by about 4 days. So if the illness was going to be 15 days, which is what was in the study, without it, it was about 11 days with it. That's a pretty good response to a medication, to a virus. The death rate in one of the studies they did was 30% less than people who got remdesivir. So this is pretty exciting, something that can actually treat it. What else? Convalescent plasma. So that is when somebody has the infection. Again, if those antibodies are protective, we take their serum, draw their blood, take their serum, and we donate that to somebody else who's seriously ill. That's convalescent plasma. So you're giving somebody passive immunity with your antibodies. So donating your plasma can be done. It's not been done a lot yet, but it is a possibility and it can work. So what were other things that were in the news, not recently, but in the very beginning of this, was hydroxychloroquine. Remember that one? It's the anti-malarial drug. It's also used for rheumatoid arthritis, and a lot of people are on hydroxychloroquine. Well, it is true that there are some antiviral properties of hydroxychloroquine, and some people suggested that it might be helpful for people with SARS Cov-2 or Covid19 illness. It went off the shelves when that was put out there, when people started talking about it. People started asking for it and prescribing it. I had people asking me to prescribe it for them, which I didn't do. When it first came out, it was only because there were observations and because of the known antiviral effect. And so there were some observations that maybe in Europe, some of the patients did better on hydroxychloroquine. Well, that doesn't prove it. So what happened was studies came from there. There was an observation that doctors made. Studies were designed to test that observation. In the meantime, before the studies were done, doctors started using it and treating people with it. They did it with some caution and trying to observe. Really, the best way to do it was only through a study. But hydroxychloroquine has some downsides, some side effects that are not so good. End result, it didn't help. In fact, the death rate was quite a bit higher in those who got hydroxychloroquine. We know there's side effects to it. There wasn't a great benefit. So hydroxychloroquine is out. I've read a lot about vitamin D on the internet this past week, and vitamin D has no plausible reason to help. It doesn't have any studies that indicate that it helps, and so there's really nothing to say about vitamin D. People have heard of Actemra. It's an IL-2 pathway inhibitor, and it's used for other inflammatory illnesses. It's being studied. It's a drug that we have around, and it could help in severe disease with decreasing inflammation by cytokine release inhibition. So that's promising. There was a lot of talk over the last few weeks about ibuprofen or anti-inflammatory drugs. It was noted by especially in Europe, that people who got ibuprofen or drugs like it did worse with their COVID-19 illness. And so people shied away from ibuprofen and Advil, those kind of medicines. But really, there was with more studies done, there's really no harmful effect of ibuprofen. You can use it. Now, it does have more side effects than acetaminophen, so acetaminophen is still better, especially for sick people with mild pain or fever. Do steroids help? No, they don't. So thinking about using steroids for this illness when somebody's really sick doesn't help. All right, vaccines. There was a lot of news about the vaccines. Now, Moderna is the first company that came out with a vaccine. They are now in phase 2 trials. So the first ones, phase 1 trials, are small trials with small numbers, and it's just for safety. So adult volunteers will take the vaccine, they'll watch them for several weeks, and they have. And the first phase 1 of that was pretty good. The safety profile was very nice for the Moderna vaccine. They're in phase 2 trials, which are larger trials, and they're trying to also look for safety, but to see if they actually get an antibody effect or an immunity effect. So that's ongoing. The other company that's doing one is Novavax. Now, they are using the spike protein that's on the surface. Every time you see a picture of the coronavirus, it's got this cell with these spiky-looking things on it. Those are glycoproteins on the surface that the virus uses to attach to your cells. It uses it to attach, it puts its own RNA into your cell. It uses your DNA machinery and your cellular machinery to produce more viruses. And so it's using those spike glycoproteins on the surface that attach to your cells, and it's making a vaccine out of it. So what is a vaccine? A vaccine is just taking a part of a virus most of the time and injecting it into your body so your body recognizes that part of the virus, produces antibodies, produces cells that remember it, and when you face the real infection, you already have a ready response to it. That's all a vaccine is. So Novavax, they're in phase 1 studies right now for safety, and it looks promising also. There will be lots of companies that come up with vaccines. It's going to be a big race. There will be more than one. It won't be until the end of this year, the start of 2021, before we have a vaccine that could work. That's what I see in the news this week. Stay safe.